I'm Dr. Fink, and today we'll be discussing diabetes and the importance of having a visual assessment done for this condition. Your family doctor will send you to an eye doctor once you've been diagnosed with diabetes, as the vasculature in the back of the eye is directly reflective of what's happening in your nephrons in your kidneys. So that's far easier than biopsying your kidney to find out what disease state we're actually at. You will be checked to see if your pupils are reacting equally and well. We're going to be checked to see if there's any blood vessel growth on your iris. We'll check to see if your eye movements are efficient and if there is any nerve palsies, which is also a risk factor if you have diabetes. Sometimes you can have a lid droop on one eye and that eye goes down and out and the pupil will enlarge. That is a third nerve palsy. And also we will check the retina, which is what you most likely will remember because you will have dilating drops that go into your eyes to make your pupils nice and big. And often we would like to use retinal imaging to document what disease state we're at. So retinal photography allows us to photo document anything that's happening in relation to diabetes, whether there's exudates or dot blot hemorrhages or neovascularization. And most of us, the standard of care is really to go deeper and see if we can catch these things earlier before they cause damage on the top portion of your retina. This is an OCT scan. It shows us all the different layers of the retina, and we can check and see if there's any diabetes occurring at a much earlier phase before it actually becomes visible to the front in a dilated eye examination or on retinal photography. The central portion of your eye here, this is what this little divot is your macula. Oftentimes, there can be fluid that's developing here. That can happen at any phase of diabetes. It can happen whether you've just had it for less than 1 year or whether you've had it for 30 years. And this is really the only way to properly diagnose, to see if there is fluid developing in the central portion of your eye. It needs to be treated very quickly, as it can impede your central vision. So the importance of having your eyes checked for diabetes is of course extremely relevant. Oftentimes there's treatments that are required if the blood vessels are starting to leak in the back. And again, we would like to have that done as soon as possible so that we can prevent any vision loss.